Good afternoon, everyone. Thanks for joining us today for the BHCC Clinical Integration Learning Collaborative webinar. We are going to get started in a few minutes. We're waiting for just a few more attendees to join, so bear with us a few more moments and we'll be back to get started soon. Thanks. Good afternoon, everyone. Thanks for joining us today for our BHCC Clinical Integration Learning Collaborative webinar. Just bear with us another minute or so. We'll be back to get started soon. Thanks for your patience. We're just waiting for a couple more attendees to join us. So we'll be back to get started in a moment. Thank you. All right, good afternoon, everyone. Thanks for joining us today for our BHCC Clinical Integration Learning Collaborative webinar. My name is Meg Beyer, and I am part of the Managed Care Technical Assistance Center team here at McSilver. And I'm excited to get things started today. Sorry about that. I made a new word, exciting and started. So a few logistics before we begin. The webinar today is being recorded, and just as we've done in the past with these webinars, we'll share them, the recording, with the slides following the webinar. We are going to have, throughout the presentation today, different sections where we're going to unmute everyone who's on the line, which is great. We'll be able to have a conversation that way. We do ask, though, that when you ask your question or share your feedback, that you identify yourself and your BHCC just so we're able to get a better sense of where these questions are coming from. It helps us with our technical assistance. And also to say that our next webinar is to be announced. Don't fret, we will be having more of these coming in 2019, so stay tuned. You'll be getting some more information via MCTAC and our state partners shortly. So those are just some of our logistics. And also to say, if you do have questions at any point throughout the webinar, please feel free to chat them in. We will be reviewing and collecting all the questions as they come in, so if you don't want to wait until one of the sections in the webinar when we're going to open up the phone lines and allow people to ask questions or provide feedback, feel free to use the chat box functionality and chat us your questions. So again, thank you for joining us today. Just a little bit of how we're framing the webinar today. The topic of today's webinar is really going to be around BHCC consent forms and the recently released OASIS Universal Consent Form. So how this is going to function today is we're going to have some presentations given by our state partners who will introduce themselves. They will take questions at different sections specifically related to the topics that we're covering today. And then after our state partners conclude, we're going to invite two of our BHCC partners to present, and not present, but really kind of discuss their perspective on this as well. And then, of course, we'll open up for more questions at the end. So with that, I want to thank everyone for joining us. And I'm now going to kind of pass the presenter capabilities to Erica, who's going to take us through the first portion of the presentation today.
Everyone, this is Erica Vanderwall Ward from the Psyches team. Thanks very much for having me today. I'm going to review some updates on the BHCC consent form. So I'll just go to the next slide. On the BHCC consent form, if you remember, we sent around a first version draft of the BHCC consent form in September for comment. Thank you, everyone, for sending in your feedback and comments on that version of the form. We got a lot of really good ideas that were incorporated into a second version of the form, of the BHCC consent form. So a version 2 will be circulated this week just for a very quick final comment before finalizing. So we'll just have that out for 2 weeks in case anyone has any final comments on the second version of the BHCC consent form, and then we'll send out a finalized version. The other update about the BHCC consent form is we did consult with the Department of Health about including a line on the consent form for the RIO, also known as the qualified entity, in the form. So I have an update about that in a moment. So this slide just shows a list of what the actual revisions are that you'll see in the second version of the BHCC consent form. The first change was that we added really a choice for the client to check one of two boxes. So if you remember in the first version, there was really just a checkbox where the client would say, I agree to have my information shared, and it listed out those specifics. Now there's a Your Consent Choice section with two checkboxes. I give consent or I deny consent. So I'll show you what that looks like. The other kind of big change was the signature section where the client signs was moved to the end of the form at the end of page 2. And the feedback on that was that a lot of the important elements that are necessary in the laws for the consent form and data sharing were covered on page 2. Things like the duration of the consent, how to withdraw my consent, and other important information that was necessary for the form is outlined on page 2. And so the best way to make sure that that was, reviewed by the client, signed off on by the client who is giving consent, was to put that signature section at the end. So we moved that there. And just to help with administration functions of this, we put blanks at the top of page 1 for the patient name, date of birth, and patient ID, because now that the signature page is at the end of page 2, you don't want to have to flip that over to find out the patient's information. So I'll show you what that looks like. The patient name, ID, and date of birth, there's a section for that at the top of page 1. We also had an idea come through about social determinants of health as an element of data content that could potentially be shared. So we incorporated that into the form as a line on page 1 explaining social needs, information like housing, food, or clothing information could potentially be shared as part of the client's record if applicable to that client. And then finally, just to help with a little bit of the kind of friendliness of the text, we added some examples of illnesses or injuries you had, like diabetes or broken bones, in the information about data that could be shared in your record. So let me show you what that looks like. The other thing that I wanted to cover is about the provider list. So one thing we talked about last time on the form is when this form was originally created, we modeled off of another type of network, a health home network. We modeled our consent form off of that originally, and the health home network consent had a page at the end that listed out all the providers in your network, and that page of listing out the providers was part of that consent form, that paper form. What we did instead on the BHCC consent form was we're referencing a blank where you can put in your website, and you really should have a section on your website in order for this to work, where you list out all the providers in your network and also the affiliate organizations, and have in your website, in this section of your BHCC website, distinguish between network providers and affiliate organizations clearly on that page, and then put your BHCC website in the blanks on the consent form. So this is how you're covering when anywhere on the form the client is agreeing that their data is going to be shared between providers, from their treatment providers to the BHCC. The client will know who those providers are by either going to the website or requesting that their provider prints that out for them if they don't have access to a computer or something like that. But this is the way you can avoid needing to have a copy, like a printout of the list of all your providers, instead put it on the website. So we did review that last time, but I just wanted to give a reminder about that. And then finally, the update on the RIO, also known as a qualified entity. We did talk to Department of Health because we heard that it was important to the BHCCs to have a space on the BHCC consent form for getting access to RIO data for the clients served by providers in your network. What we learned is that was okay, and that was all right with the Department of Health, but what we learned was what's even more important is to really connect with the RIO in your area and get their permission. So if, for example, HealthX is the RIO in your area, you'll want to reach out directly to them and ask them if it's okay to include HealthX in that blank on your consent form. And then you can fill that in, and then that will, then ideally that would cover exchange of information from the RIO to a BHCC user. And to that point, I wanted to ask the group if there's anyone on the line today from the BHCCs that have had any luck connecting with their local RIO. I know we had a nice presentation from Carrie Ann from NICE at our in-person event, and people from the BHCCs were expressing interest in getting access to this RIO data and wanted it covered on this consent form. So has anyone from the BHCCs been in touch with a local RIO that you might have any lesson learned that you wanted to share with the group? And I was wondering if Brad could open up the lines, unmute everyone in case anyone had any lessons learned to share about connecting with a RIO.
All right, so as Brad unmutes everyone, just a reminder, if you have anything to share, feedback or questions, if you could just let us know who you are and also which BHCC you're a part of, that would be helpful.
Jordan?
So everyone has been unmuted. So we can kind of hear some background noise, just as an FYI.
Has anyone been in touch with your RIO, your local RIO?
Hi, this is Andrea out in Western New York. I'm the Vice President at Value Network, and we are working with our local RIO. We are actually collaborating with them on a specific project. It's pretty cool. We're collaborating with our local PPS and our RIO to try to actually get to share care plans through the RIO. They're going to try to create a separate type of process where not only the clinical people can comment on a care plan, but also folks such as affiliate members could comment. So what they're trying to do, obviously this is in the beginning phases, they're going to create some sort of link. And, you know, I'm not a technical person, so I might be saying this technically wrong, but basically if I'm the user at an affiliate agency that doesn't, you know, provide clinical services, but I might provide parenting education classes, I could follow a link. It would lead me, I would get kind of like an ADT alert. I would get an alert. No, I said that wrong. So I would be able to comment on a client and say, you know, Andrea has been attending parenting classes, and then whoever owns that care plan would then get an alert. They would get an alert, and they could either add that information to the care plan or just kind of digest that information. So that's the kind of innovation we're working on with our local RIO. So not directly related to consents, but just more that whole, you know, clinical integration across the system. So just thought I'd let people know about that.
That's great. That's really interesting. Thank you, Andrea.
You're welcome.
And did you guys have a chance to touch on the consent? Do you think you will be including that RIO in your BHCC consent form, or still to be determined?
Oh, no, we definitely will, because since they're working with us so closely in that other area, they're definitely going to be on.
Great. Any other lessons learned people wanted to share about working with the RIOs so far? Okay, thank you, Andrea.
You're welcome.
I now just have 4 slides that are screenshots of the BHCC consent form version 2. So I'm just going to go through this, and then I'm going to turn it over to Mark Foss to talk about the OASAS Universal Consent Form, and then we can do questions about the forms. So this is going to go...
Erica, this is Mike Guardieri. I was on mute. I was rambling along. So we've had some communication with HealthX, and talked about consent but not adding them to our form, but they were very, you know, if we can get the consent on our end, and we were talking about passing the consent electronically to them, so the list, so that they could add the patient to having consented to HealthX. So, you know, we're in discussions moving towards that direction. So we get it once and load it in their system at the same time.
That's great. Thank you, Mike. Okay, now I'll go through the BHCC version 2, and you'll see the changes that I was outlining on the other slide. So you'll put your name on the blank at the top, the name of the BHCC at the top, and then this is a section that was added here in the second version, after this is filled out for the blanks that have to be pre-filled, then you can print these out and have some copies available, or actually I should say your providers can print these out, have some copies available, and when they're having a patient sign it, they could have the patient fill in their name here, and the signature page, I'll show you, is moved to the end of page 2. So this is really just a place where so that you have the patient's name, date of birth, and ID number at the top of page 1, just for like, because after it's signed, the person kind of putting these into your system or to Psyches will have that information handy at the top. So that's there now. Once you fill in, on our version of the PDF and the send out, once you fill in your BHCC name in this blank on the top, it'll become pre-populated on the rest of the form just for ease of filling this out. So in the first paragraph, it's orienting the client to what a BHCC is and the purpose of sharing data between your providers and the BHCC. So by signing this form, you agree to have your health information shared with, and then the BHCC name will be added there. The next paragraph is about where the information is coming from and what, where that's going to be shared between the providers and the BHCC, between the providers. So it's your health records, it's information that might be coming through the RIO or through Psyches. So for a list of the providers, you'll have your website listed here in this blank. If you are working with your local RIO and they have given permission to put their name here, you would put the specific RIO name here. And then it also mentions Psyches, which is our application run by OMH. It just gives a couple of sentences about the RIO and Psyches, what they are. The next paragraph is about what data is going to be shared. And it's also really kind of giving the details about this. These providers in the network, which are available on the BHCC's website, are allowed to receive, view, read, and copy and share with each other all of my health information. And this could include, this is my health record, that might include information like illnesses or injuries, like diabetes or a broken bone, test results like x-rays, blood tests or screenings, assessment results, and so on. Your health records might also have information on, and then I'll go to the next slide. And then we just made 2 small changes to this list. In front of inherited, we added the word genetic, inherited diseases, which has special protections, which is why it's called out specifically, just like AIDS, HIV/AIDS information and alcohol or drug use information. It has special protections on it, so it's called out specifically in this list. And based on BHCC feedback, we also added social needs information as a potential element that could be shared. And then at the bottom, you'll see this section was updated to be more of a choice, your consent choice. So they can check I give consent for, and then the BHCC name would be here, and all of its participating providers to access my health information, or I deny consent. So if they check the I deny consent, then that should be maintained, or at least you wouldn't indicate that consent, or your provider wouldn't indicate that consent, for example, in Psyches, because they've denied consent. A good just thing to point out in the training and rollout of this. Now on to page 2. So this is pretty similar to the first version that went out. The sections here talk about how will your information be used, where does your information come from, what laws and rules cover your information, who can see it, and what do I do if I have some concerns that my information was accessed inappropriately. And then the second half of page 2, duration of the consent, who do I contact if I want to withdraw my consent and I want to get a copy of this form. So this is where the signature section was added to the end of page 2, so, and with this kind of statement about acknowledgement of understanding, that I'm understanding the terms of this consent form, and I know I can contact my provider or the BHCC if I have any questions. So this is where the patient would sign or their legal representative would sign at the back of this form. So we're going to take questions in a moment, but first I'm going to turn it over to Mark Foss from OASAS Council to talk about the OASAS Universal Consent Form TSR 64.
Hello, everyone. It's good to be here. Thanks for everyone turning in for some discussion on these consent forms. So OASAS over time has drafted numerous consent forms depending on various initiatives that the agency's been involved with or our providers have been involved with. And with the recent changes to the confidentiality law, we were asked by a number of our providers to assist them in shaping up a consent form that meets the current revised rules, specifically how to deal with entities where the name of the individual has to be added in conjunction with the name of the entity that's going to receive the information. So what we've done here with this TRS-64, we don't really envision it as a true consent form like some of the other forms that we have on our website. What this is intended to be is basically a starting point. It's intended to be used by our providers anytime they are going to exchange any information through one of the RIOs or qualified entities. And so basically we've just ensured that the elements that are required under Part 2, the Federal Confidentiality Law, are in place on this consent form, and that the provider who wishes to utilize this consent form can take this consent form and shape it to their particular purpose. Certainly the BHCC consent forms are a good example of how you start out with a basic framework, and then the participants themselves determine what an acceptable consent form would look like. So one thing I want to be clear about is that the TRS-64 is not intended to compete with any other consent form. It's not required that the TRS-64 be utilized as opposed to any other consent form. It was simply intended to be a starting point for our providers so that they had something to begin with to draft up a consent form for utilizing in whatever initiative they're going to engage in. So I don't know if anyone has any specific questions about TRS-64, but I'd be glad to address those.
Thanks, Mark. So this is Meg from MCTAC again. So I'm going to ask Brad if he could unmute everyone. And if there are any questions specific to the OASIS Universal Consent Form or anything that Emily may have walked through earlier on in the presentation, feel free to use this time to ask those questions. So I think Brad is going to unmute all the attendees, and folks are going to be able to speak up and ask the questions.
Hi, Dave Eckert here from the Finger Lakes Behavioral Healthcare Collaborative. Can you hear me?
Yes, Dave, go right ahead.
Hi, thanks. I'm just, if you could say a little bit more specifically about how the OASIS-specific TRS-64 works with the universal consent. Is it that OASIS providers would use this as a model for their internal consent and obtain the universal consent as well?
Well, the TRS-64 is our universal consent. And again, the idea of this consent was that if one of the providers wanted to exchange information over a health exchange information system, they could utilize this consent because it starts to lay out the framework of obtaining the patient's consent to do so.
And the universal consent that we viewed first in this presentation, if that were in place, would it need the TRS-64, or would the specifics in the TRS-64, are they also included in the first consent we viewed?
Yes, the BHCC, the proposed BHCC consent has all the elements that are required under Part 2 incorporated into it, and it also has the benefit of consideration of input from BHCCs as to how they anticipate the information is going to flow and what information their clients are going to require to actually successfully consent to the transmission of their information. So no, the that's my primary goal here, is to assure people that if they're comfortable with the way that the BHCC consent is drafted, there is no need to utilize TRS-64.
Thank you. I appreciate that.
Sure.
So Mark, go right ahead, please.
I'm sorry, this is Robert Robert Grolling from Casa Trinity. We're an outpatient substance abuse program, and we're engaging in an exercise of a value-based network partnership group. And I just want to make certain from my end that if we get this release, this would allow our network providers and affiliates to come to the table to discuss PHI openly in a case conference format.
Well, the release is simply where the client is agreeing that their information can be disclosed. You know, if you need to engage recipients in a discussion as to how the information is going to be transmitted or exchanged, I think you would do that separate from the consent format. Do you have questions as to how these participants would exchange the information?
Well, we have 4 providers and 3 affiliates who are coming together as a network partnership team, and we have a cohort that we're focusing on. So to get into this cohort, the individual patients need to sign a consent that allow us to communicate with one another. And I just want to make sure that we're covered when we come to the table to discuss the cases between the 4 providers and affiliates, that we are doing so with, compliance.
Okay, so when you ask whether you're covered, you mean you're able to exchange or identify individuals without violating the federal confidentiality law? That's your question?
Yes, that's right. It's like a case conference, only with several providers and affiliates present.
Right. So if you take a consent form and you identify who all those participants are going to be and how the information and how and why the information is going to be exchanged among those participants, then yes, a proper consent form identifying that information would be sufficient.
And you're referring to the TRS-64, is that right?
Or something that is similar, yes.
Okay.
These are consent tools that you can use. You can use either one. What you might want to do is the BHCC one was designed with BHCCs in mind, so there's a place for the BHCC written out specifically. I mean, I think what Mark's pointing out is either form can be used. You just have to specify who's going to be viewing the data. With the BHCC being a network, you would you have the tool of, and really both forms do this. You can access the website of your network that lists out all of the providers, so that the client signing the form knows these are the providers that are going to be involved in the data sharing. And that data sharing takes place maybe as a case conference, as you say.
Yes.
But you could use either form as long as it's clearly specified in that form.
Okay, that's very helpful. Thank you.
This is Andrea again from Value Network out in Western New York. I was wondering if this form has been fully vetted with DOH as being compliant with the SHIN New York policy.
What we learned, we talked to Jim Kirkwood from Department of Health about including on the BHCC consent form, the one I was presenting on first. The BHCC consent form has a blank for the RIO or the QE, and we did get the blessing that we could include that in the form. But what Jim said is it actually, rather than just having DOH give their blessing on the form, what each BHCC should do in order to put a specific RIO in that blank is you have to contact your local RIO and get their permission. So it's not just permission of DOH, which we did get. It's permission from that individual RIO.
Okay, because I've been emailing my contact at the RIO, and they're willing to sign, but they just wanted to make sure that it's compliant with that policy, because they weren't sure that it was fully approved by DOH. So before they could say yes, they wanted to make sure they were in compliance.
Okay, yeah, that makes sense. That's fair.
Okay, so you're saying yes, it's been vetted. Jim Kirkwood gave you the approval to include on the form, and as long as they say yes, that DOH has said yes, so then it should be good.
Yeah, and Andrea, we did that over a call with Jim, so if they need anything in writing or anything like that, let me know and I can do my best to facilitate that. I'm
sure they would appreciate that, because I don't think they feel that they've gotten the responsiveness that they would have liked. So that would be great. Maybe I'll copy you on, is this Erica?
Yes.
Yeah, Erica, I'll copy you on an email with my contact at my Rio, and then we can go from there.
Okay.
Thank you.
So this is Mark Boss. If I could just comment on that. This, again, is one of the reasons why it's really helpful to come up with an agreement as to a standardized consent form. So if all the BHCCs agree that the developing BHCC consent form will work for them, and then you do get sign-off that the RIOs believe that the form is consistent with the shiny rules, you've really cleared a hurdle, and that all the other BHCCs don't have to go out and try to draft their own consent form, get the approval, and then convince everybody else that, yes, this language is actually acceptable. That's why we've moved to standardized consent forms in a lot of applications. So I think this is a good discussion. I think if you get the shiny sign-off, that then everybody can be a little bit more comfortable utilizing the finished consent.
Okay.
Hi. Hi, this is Caroline Heinrich from As One in New York City, and I just had this is the last couple rounds of questions were really good clarification for me and understanding that the BHCC consent form is one that covers a number of consenting items. I just wanted to clarify. So this will not only allow us information sharing regarding the RIOs and also the Psyches dashboard, but also, between the BHCCs, not between the individual BHCCs, but within a BHCC network, sharing of information, for example, on a shared IT platform. Is that something that's also covered in here?
Yes, that's one of the goals of this BHCC consent form. So I'll speak to the BHCC consent form. I'm sharing the top of that form on this slide. The BHCC consent form would allow for that data sharing if the client signs permission and all of your providers and any affiliate providers contributing data to that IT platform are listed on your website that's referenced on this form.
Got it. Okay. And are you going to talk about the time frame as to when you think this will be released?
It was recommended that we send it out one more time just because there were a few changes and just want people to have one more chance to give any feedback. But that'll just be a quick turnaround this time of a couple of weeks to send in your feedback. So I'll send this out this week, or I'll work with Ileana and Lynn to send this out this week, and then close it after 2 weeks for feedback, and then we'll send it out. So maybe it's just in the new year we'll send it out a final version.
So Erica, this is Andrea again. I just want to make sure I heard that was a really good point, the last question / statement that was made. So I want to make sure I heard it correctly. So if Value Network has a shared data IT platform, I would have to list on the Value Network webpage that not only all the entities, which I already have on my webpage, but I'd also have to say something to the effect of data maybe share or IT platform. Like, what if I have 3? Like, we might be using Millennium, PPS, our own internal platform, and something else. Like, do I just kind of list them all? Is that what you're saying?
So. I think, and Mark, correct me if I'm saying anything wrong, I think the platform is the way and the mechanism in which you're sharing the data, but what you're sharing and what you're getting permission for on this form is the data to be shared. So I don't know that you need to specifically say the name of your platform sharing the data.
Okay, thank you. That's why I was getting confused. So I just need to make sure that everybody's listed that will be sharing the information.
And they're like contributing the information to this platform that and going to be sharing between your providers and so it's like it's health records.
Yep.
From these providers, which is specified in both of these opening paragraphs, paragraph 2, paragraph 3, and the list of example elements that might be shared. If there's anything missing that's going to be in your platform that's not covered on this form that you think other BHCCs might benefit from, like review this when it gets sent out again, and then just write back to us saying we really thought this was missing and we want it to be covered in this form and we think it might be helpful for other BHCCs to be covered in this form. Maybe we could add it. I'll take it back to our lawyers to get their input. But that's what happened with the social determinants of health. One BHCC felt that was really missing, so we added it in.
Okay. The other question is related to the RIOs again. So I thought, I don't remember where the conversation started, but I thought that the RIOs were going to be, I know obviously they're on the consent, but does this include the required consent that they need, or do they still need their separate consent? Because I thought the purpose was to have it universal, obviously for OASIS, OMH, and for the BHCCs, but also for the RIO. But is that not the way that you see it?
Yeah, I think that was our goal in this form, that it would cover both. But what Jim Kirkwood's feedback to us when we talked to DOH was that they probably will want to review this form too.
So if they have suggestions or modifications when you send out the next version in the next couple days or whatever, we could just get those back to you based on our conversations with our local partners?
I think that makes sense.
So this is Mark Foss. What I believe the consent will do will allow the participants in the BHCC to access the services of the RIO to exchange the information among members of the BHCC who have been identified on the BHCC's website. Just because the RIO can exchange the information doesn't mean that it opens it up, that information, to all participants in that particular RIO.
Okay. So it would cover, so are you saying those participants who are in the BHCC?
That are,
go ahead.
Yes, that are identified on the BHCC's website. So basically, to get legitimate consent, you need to advise the client as to whom is likely to access their information.
Right.
And so the entities that are identified on the BHCC's website, that provides that information to the client. But of course, the RIOs are providing services to many, multiple of clients or participants beyond the BHCC, right?
Yeah, that's a great point. As I'm reflecting on that question, this probably won't replace, when the providers are getting the clients to sign the RIO's consent form to participate in a RIO, this probably won't replace that form. I can't imagine this would have the power to replace that form. I think the goal of this form is that the providers could then share that information they get with you, the BHCC.
Okay, thank you.
Hi, this is Carol Teitler from South Central BHCC. So I have a question, maybe it's more for the other BHCCs, but so we have, if we're referencing our website to say these, these are the members of the BHCC, but we have some affiliate partners who are not providers of Medicaid services for, like a Tier 1 provider, a local coalition, a United Way, a rural health network, that kind of thing. So do we need to, should they be included, and do they have a right to see somebody's health information at that level of partnership or not?
And this is a question Mark and I discussed about, and Mark was explaining to me the difference between a treatment provider and a non-treatment provider, and I think, Mark, do you want to share what you taught me about that, about the listing that out specifically on the website, perhaps?
Right. So So if you foresee a need to share information with affiliates, non-treatment provider affiliates, they have to be identified as well. And so you can identify them on the site. Of course, every participant you identify and every affiliate you identify is not necessarily going to have access to the particular client's information. It's only based on what is actually necessary. But yeah, you would have to identify them on the website that you're utilizing to also identify your providers.
Okay. All right, I'll take it back to our board and we can talk about that. I'm just thinking that, you know, someone, if they thought that, gee, my health information is going to be available to the United Way, their personal health information, that, you know, they don't want that. And so we'll have to figure out how we want to approach them.
Well, if they didn't want it, you wouldn't give it to them any other way, right?
Correct. We would, yeah. You know, but if we just say the members that are listed on our website, it's all encompassing as it would be right now. And I'm thinking on our website we need to differentiate between the treatment providers and the non-treatment providers, perhaps, and say, you know, that it's the treatment providers that are reflected for this form. Does that make sense?
Well, but it's also really, right, even your universe of treatment providers, not every one of those treatment providers is going to need access to that client's record. It's only the provider who's actually providing services to that client.
Yes.
So there's the option, or there's the ability to, of all the providers in the BHCCs, to access. But in reality, the only ones that are really going to be able to access are the ones that are actually have a bona fide reason to do so, to provide services.
Correct. Okay. All right. Okay, thank you.
Sure.
These are great questions. Thanks for the discussion, everybody. And I think now I'll turn it back over to Meg for the next section. And let us know if you have any other questions that come up.
Thanks so much, Erica. So as I wait for Erica, thank you for passing the presenter ball. So the next portion of our presentation today is really going to be having a BHCC representative share their perspective. So I'm going to ask, I think Mike is our BHCC representative on the line. Mike, you have about 10 minutes. I would probably recommend closer to 7 just to see if there's any questions for you before we wrap up today.
Great. Thank you very much. And thanks for inviting me to be on the call. And what we've done is worked with the staff, Mark and Erica and others, and we think there does need to be one more step to make this a universal form, at least in our paradigm. So what we're working with is to add language around all my treating providers, which was not the intent of the BHCC form, but we've taken the TRS form, the BHCC form, tweaked them a little bit with really client experience, in our mind. So some of the recommendations and what came out of the form, changing some of the things around to make it clearer for the client, was part of our purpose, because we do think that having all the consent information one place really is more effective with clients. It's not confusing, and consent is consent. So, we don't want them to sign one consent for psyches, one consent for PHCC, another consent for something else. We want to have it all in one place and deal with consent as a treatment issue. And so if someone doesn't consent early on in treatment, well, it's not something you just let go. It's something you have to revisit. So it's important to have a consent registry to help identify who is and who isn't consented. On the discussion that we just had, I think that's important. because in our view, it's not quite a universal consent yet. To handle all those providers that are outside of a BHCC, may not be in a RIO, we want to add that all my treating providers language, which is the language from the new regs in Part 2. And we're working with Mark and Erica, and hopefully we'll nail that down soon. And that will work in our situation where we'll have a clinical viewer. So people mentioned if you can look at the data electronically, you'll see it in one place so that everyone can do a good coordinated treatment plan on the patient. It allows for sharing electronically or on paper, verbally, doesn't make any difference. So I think that'll help not only the providers, but it'll be clearer from the patient experience, getting one explanation about consent. And then they'll understand that, consent in our view from AHN is that, it's consent to help coordinate care for all of your treatments. And, if a client doesn't want to share information, I mean, that's okay, but we need to keep that as a treatment issue and then continue to do motivational interviewing around the benefits of sharing their information. Some patients may never want to share information, and that's fine, but I do think we have a responsibility to educate clients about, what the benefits of sharing their information are. Because in our view, you do get better treatment if all your providers coordinate your care. So that's how we came to it. We'll have more discussions with Mark and Erica and hopefully nail down that next version that will work for us, which also requires, us to have a consent registry. I think that's paramount with this, otherwise you'll never know who did, who didn't consent, and that's built into our electronic and our data platform model. So these are very, very helpful templates to help us get started, provided great guidance for us to move forward. We worked with an attorney, Renee Popovich, who's a SAMHSA expert. So bringing all those minds together with OASIS around this is very helpful. And we'll hope to, in the next couple of weeks, do another webinar from, AHN. And I must say that RHS, Recovery Health Services, worked with us, with Renee. We hired the same attorney to move this forward. So we'll do another webinar later on from, our auspices about this. But this is a great start, and we really appreciate the opportunity to piggyback on what's been done already to tweak it to the next level that we think that we need.
Thanks so much, Mike. So this is Meg from McTack again, and we have about 5 minutes left on our webinar today. And so the last portion of our webinar today was just to see if there were any questions for Mike on what he shared, and if not, if there are any questions specific to the topics that were covered today. So BHCC consent, the OASIS Universal Consent Form, or anything that Mike shared. I know we don't have a lot of time. I know there were some questions chatted in, which we'll try and answer in an FAQ format. But Brad, if you could unmute everyone just for the last couple minutes to see if there were any questions from folks who have joined us today.
Hi, this is Dave Eckert, and I have a please let's just make sure kind of question. But the consent obviously allows you to use clients' data for reporting purposes as well, right?
Yeah.
Okay. Again, I thought it was no dumb questions, right? But thanks for clarifying.
And this is Erica. Just wanted to clarify what you mean by reporting purposes. Well, at the BHCC, certainly we've got these contracts signed with our PPSs and memos of understanding, et cetera, that are very data dependent. So we want to make sure that when clients are signing these consents, we can use their data in an identified way, because some of it does involve reporting back in client-specific ways, and clearly we need consent to do that. So to be able to report back in client-specific ways around particular metrics being met and successful outcomes,
that this consent allows us to do that.
And this
So
is just go ahead, please.
I'm sorry, this is Mark Foss. So just in response, if you can identify the entities that you wish to share the information with on your website and reference the consent to the website, that's what you need to do to ensure that you can use it that way.
Great. Thank you for that clarity.
Okay. Any other questions? Thanks, Dave. Thanks, Mark. Thanks, Erica. Okay. Well, as I noted earlier, this is going to be recorded, so we will be circulating the recording later on. I want to thank those of you who chatted in questions, and I acknowledge that we did not get to all of them today, but I have them collected in a document, and I'm going to circulate them to our state partners, so hopefully we can follow up after the new year with some answers to those questions. And then in the meantime, if you do have any questions that are specific to the Psyches team, here's their contact information. Please feel free to reach out to them directly, or you could always reach out to any of us at MCTAC at mctac.info@nyu.edu. So thanks again, everyone. Thanks for joining us for all of these webinars in 2018. We look forward to launching some more in early 2019. Happy holidays and have a great start to the new year. Take care.
All right, bye-bye. Thank you.